the other day, and I was grateful to you because I know when the health care bill was first started, there was a part in it that said that doctors should tell older patients maybe they didn't need as much care. And I understand that you were one of the people that got that taken out before the health care bill became law. And I'm grateful to that. There's another concern, though, in that all the hospitals are being made to go online, and that wouldn't be bad. But you know, the way hospitals are now, they can send emails and send information to each other. I think the main reason for this is because the government wants to have all the information on us so that they will be the ones that decide whether you get care or not. I understand that's even part of the bill, that there is a committee that would be set up to examine these things, and so the government would be between every doctor and every patient. And that's probably why the doctor down in Florida decided not to see patients who voted for Obama.
I can't comment on that last point. I did see that on the news. Let me comment, first of all, thank you for thanking me on that first part. If the first part holds true, that doctors can't do that, then I don't think you need to be concerned about medical records in regard to that. You do have a right to be concerned about medical records that your privacy is protected, without a doubt. And the committee you're talking about has a legal term that I always have to ask my staff. The Committee on Effectiveness. What's the complete title? Well, you don't know either. That's okay. But the purpose of it is, but also there's fear that the purpose can be misused. So let me talk about, if it's used right, the extent to which there's going to be, I guess you'd call it an institute, set up to study different medical procedures and I suppose treatments and maybe even what medical devices might be used, maybe what drugs might be used. The extent to which they study that, and that is, and they come forth with recommendations that this works better for this price than what this does for that price. Or maybe price isn't necessarily a factor. What works best here, this doesn't work so good over here. The extent to which that is just information for doctors to use, then I think it's a good thing. But the extent to which people fear that that could be used like in England, where there's an acronym, and this is another term I can't remember what the letters stand for, because it's England and I don't have to worry about England very much. But anyway, NICE, NICE. There's a part of the, I suppose it's part of the public health system over there, which you know is government run, that determines value of life. And so it determines value of life for so much. And so if you're 85 years old, presuming you're getting an end of life, your life's not as worth as much to spend on a certain procedure as if you're 35 years old, see? And then it becomes a tool to determine treatment or not treatment. Then from my judgment, that is political interference in the practice